Ibrima says, Sheikh, I'm second-year medical student, and I was wondering if doctors will be held accountable for a life that's lost due to their error. Maybe a wrong prescription or something went wrong during surgery, and that was the cause of death, even though he was trying to save the life. What's required for this sin to be forgiven? That is the expiation, the kafara, if it is considered to be a sin. It is not a sin if there is no transgression or negligence. And this is a well-known fact in fiqh. If a person is qualified to be a doctor, acknowledged to be a surgeon, known to have knowledge in medicine and prescribing medication, in this case, if he did not transgress, he didn't do anything or overdo anything, nor neglect, there was no negligence from his side. He was operating, the patient was willing, meaning that the patient has given his consent, all the circumstances are normal, he did the right procedure, but the patient died. There was nothing from his side to cause this death. Then there is nothing on him, none whatsoever. When is he considered to be at fault? One, if he is not knowledgeable. So a student of second year or third year in medical school performs an operation. He's not qualified. The patient dies. An arm is amputated. Something harmful happens. He is held accountable and he has to give the expiation. A person who claims to be knowledgeable and has no knowledge, he's accountable. A person who's knowledgeable, but he used a procedure that is risky or unknown to work, so he's trying to experiment, he's accountable. He prescribed a medication that was not tried before, or the possibilities of the side effects were far greater than the good ones, and he did not notify the patient, he just gave him from his own, he's accountable. A qualified doctor who's well known, operating or doing a procedure without the permission and the consent of the patient, and the patient dies, he's accountable. Why? He was trying to do his best, yes, but he did not take the consent. So once you take the consent and you're qualified and you do your best and the patient dies, there's nothing on you. So I hope this answers your question, inshallah.